There is no sole solution to fixing various mental health issues and addiction, especially cross-culturally. Cultural backgrounds and values can play a big role in determining compatible methods of treatment that will work well for patients of that culture. This is the case for video game addiction in China and the Netherlands. While there are some similarities in their assessment, the success they achieve in helping their patients, regardless of the differences in their treatment methods, goes to prove this point that there is no sole solution to battling video game addiction. Video game addiction, according to psychiatrist Dr. Michael Brody, set forth the following criteria. The person needs more and more of a substance or behavior to keep him going, and if the person does not get more of the substance or behavior, he becomes irritable and miserable. Dr. Kimberly Young, clinical director of the Center of Online Addiction and author of Caught in the Net, says compulsive gaming meets these criteria, and she has seen several withdrawal symptoms in game addicts. They become angry, violent, or depressed, and if parents take away the computer, their child sits in the corner and cries, refuses to eat, sleep, or do anything. Unlike with substance abuse, the biological aspect of video game addiction is uncertain. Research suggests gaming elevates dopamine, Young says. But there's more to addiction than brain chemistry. There's a psychological component to the addiction, knowing I can escape or feel good about my life. According to Maria Konnikova, a writer for The New Yorker, some of the same gene mutations found in alcoholics and drug addicts, for instance, are often found in problem gamers. Furthermore, the neurochemistry that these addictions evoke in the brain are similar. Trevor Robbins, a cognitive neuroscientist, and psychologist Luke Larkett, both at the University of Cambridge, found that the basic neuroscience of the two types of addiction showed a substantial overlap. Haley Tsukiyama from the Washington Post wrote about Hillary Cash, co-founder and chief clinical officer of Restart, a video game rehab center outside of Seattle, who knows these warning signs. She first treated someone for this addiction in 1994, a man whose addiction to online gaming cost him his marriage. Many of her young clients have poor impulse control and an inability to plan for the future. Even the thought of having to plan a meal, Cash said, can lock some of her patients up with fear. Keith Backer, director of Smith Jones Addiction Consultants in Amsterdam, Netherlands, and founder of Europe's first clinic for video game addicts back in 2006, tells WebMD he created the new program in response to a growing problem among young men and boys. The more we looked at it, the more we saw gaming was taking over the lives of kids. According to the Irish Times, the latest Dutch report has collated statistics from 8 addiction clinics nationwide and finds that while the number of youngsters being treated for computer game addiction was 256 in 2011, that figure rose to 426 the following year, an increase of 66%. The key, he says, is to show gamers they are powerless over their addiction and then teach them real-life excitement as opposed to online excitement. The program lasts 4 to 8 weeks, including discussions with therapists, efforts to build patients' interest in alternative activities, and the use of theory of planned behavior as an extra tool to combat future relapses. According to an article from the International Journal of Mental Health and Addiction on assessing problematic video game usage using the theory of planned behavior among young Dutch people, one's behavior is determined by an intention to engage in a particular behavior. Intention is a function of 3 social cognitive constructs: attitude, subjective norm, and perceived behavioral control. The main idea is that the more control one has over their gaming behavior, the lower the intention to play excessively will be. The cultural factors that could play a role in the addiction levels and their treatment choice are the fact that the Netherlands has a large gaming culture and a heavy influence from esports, the third nation in the world to establish their own league. The gaming culture makes it all more of a cultural norm among the younger generation. The Netherlands for years has also been known as the Center for Cultural Liberalism and Tolerance. This leads them to govern and lead treatment with a warm and open approach to their treatments and use of TBB. This is in harsh contrast with the treatment methods and cultural factors of China. Video game addiction is treated far more harshly in China as opposed to the Netherlands. This is mainly due to their militaristic methods in their rehab centers. Daxing, a suburb of Beijing, is well known for their military-style addiction center where patients go through physical training, medication, and psychological therapy to reconnect them with reality. It was one of the first of its kind founded in 2004 by Tao Ran, the center's director, who claims a 70% success rate, keeping patients behind bars and guarded by soldiers for 3 to 4 months. One of the main forms of psychological treatment that the patients across the nation go through is called cognitive behavioral therapy. CBT treatment usually involves efforts to change thinking patterns and develop a greater sense of confidence in one's own abilities. CBT treatment also involves efforts to change behavioral patterns by facing one's fears and learning to calm one's mind and relax one's body. A study published in an article in Children and Youth Services Review on the role of cognitive distortion in online gaming addiction among Chinese adolescents found that adolescents who participated in CBT experienced a significant decrease in the severity of their online gameplay addiction and CDC scores following a 6-week treatment period compared to those of the control group. China is one of the global leaders in gaming addiction and has the greatest revenue gains for esports in the world, and has ever since their massive culture rose dramatically within the past 2 decades. This gaming culture, much like the Netherlands, has allowed this widespread gameplay to become a social and cultural norm. Their treatment choice of CBT for addicts comes from their cultural values rooted in Confucianism, Buddhism, and Taoism. These religions and lifestyles strive for simplicity, moral discipline, work ethic, and acceptance of rules and authorities or experts. CBT's non-confrontational design allows for smooth integration within Chinese culture, and its focus on learning to calm one's one's mind and relax one's body fits well within these values. After studies done on its effectiveness, it was found that there was a strong level of compatibility with the Chinese culture, a solid benefit for the patient's recovery. It is clear to see how the approaches and treatment methods differ between the Netherlands and China. The Netherlands' open form of detox clinics and planned behavior theory gives patients space and lots of freedom to discover other hobbies in a relatively short time, while China's strict militaristic camps regulate and confine patients' minds and bodies with the help of cognitive behavioral therapy that keeps the patients to a level of moral discipline and guidance in their search for remission. The two nations do have some similarities in the fact that both groups achieve significant success and growth and find ways to blend their cultural values and their methods of treatment. This similarity, no matter how small or on the surface it may seem, goes to prove this idea that regardless of the differences in history, culture, and treatment, both China and the Netherlands have recorded significant improvement among their patients, proving that there is not one sole solution to fixing issues in mental health and addiction, and that a specific culture's background and values should be used to determine an appropriate and compatible method of treatment.